I'm the director of Maine Center for Disease Control and Prevention. I'm delighted to be able to join you this afternoon to provide you an update on where we are with respect to COVID-19 for the entire state of Maine for today, Tuesday, April 20th, 2021. As of right now, 57,965 cases of COVID-19 have been reported to Maine CDC, an increase of 420 cases since yesterday. Of those, 43,444 are confirmed and 14,521 are probable cases. Of the cases that we reported yesterday, those 420, 94 were among individuals who were diagnosed on the 19th of April, 77 were among individuals from the 18th of April, 128 were from the 17th, 104 were from the 16th, and the remainder were from the 15th of April. Sadly, we've logged 767 deaths associated with COVID-19 in the entire state since we began our work on the pandemic. Cumulatively, 1,778 people have been hospitalized. Right now, across the state, 104 people are in the hospital. 35 of them are in the intensive care unit. 69 of them are in non-intensive care unit beds, and 14 are on ventilators. Turning now to vaccines and vaccinations. We've reached two milestones of note. Right now, we have administered as a state more than 1 million doses of COVID-19 vaccine across the entire state. Cumulatively, we've administered 1,002,361 total doses of COVID-19 vaccine statewide. About 569,000 of those are first doses, 433,000 of them or so are second doses. Over the weekend, we marked another milestone. Over the weekend, we hit a point at which over 50% of eligible Mainers had received at least their first dose of COVID-19 vaccine, eligible being those who were 16 and over. So that means just in the recent days, we've hit that mark where at least 50% of folks who are eligible have gotten their first dose on board, and in the aggregate, over 1 million doses of COVID-19 vaccine administered across the state. That's strong, resounding, and remarkable progress. We, of course, have more work to do, namely that other 50% of the state. But where we are right now puts us on strong footing to continue our work around vaccines and vaccinations. We've built an architecture that can accommodate more doses of vaccine if they arrive, when they arrive, from the federal government, and get those into arms as quickly as possible, thereby turning vaccines into vaccinations. I couldn't be more proud of the work that we as a state have accomplished. These findings, these milestones are not accidents. They are the result of deliberate work, collaboration, and planning that's gone on for weeks, months, before the first doses even arrived. I'd like to take a moment to thank a few groups for getting us here. The first are the numerous different vaccinators that are out on the ground, whether that's hospitals, EMS clinicians, independent pharmacies, some doctors' offices, you name it, commercial pharmacies, you name it, they are out there on the ground being the ones actually getting shots into arms. I'd like to just take a second to thank them for everything they've done to get us here. We wouldn't be here without you. The second is I want to give a quick shout out to our team here within the Maine CDC at the Maine Immunization Program. That team's run and led by a woman named Tanya Philbrick. Tanya has been at our side throughout this entire process of COVID and has been really one of the architects of the system that we've put into place to order doses and to get them to the places that can turn them into vaccines. She and her entire team have been nothing short of spectacular. I'd like to just take a second to recognize and thank them. But the real key to why we are where we are right now, and at the time period that we are in, is because of all of you. Maine people have shown that when the vaccine has become available, they want it, they sign up for it, and you've demonstrated that the vaccine is not an abstraction in Maine. It's something that, when offered, is something that people will go, seek, find, and take advantage of. That is the reason why Maine's numbers are where they are, and we would not be here first and foremost without all of you across the state. We just have to keep it up now. Speaking of vaccines and vaccinations, one other announcement there. As we've talked about at these meetings, we, in partnership with our colleagues at FEMA, have a mobile vaccination unit that is making stops at various different parts of the state. We've been working with the team at FEMA to expand the offerings at that mobile vaccination unit. And starting today, we are now offering vaccines at the mobile vaccination unit in Windham without a prior appointment. That is to say, no appointment is needed at the Windham Clinic only, today, tomorrow, or Thursday. Now, today's appointments actually have been booked up, which is a great thing. But tomorrow, Wednesday, or Thursday, you have two ways of potentially getting vaccinated at the Windham site. The first and the preferable option is to call our community vaccination line and book an appointment. That number is 888-445-4111. But if calling isn't an option, or if your schedule is unpredictable, you can also go to the mobile vaccination unit in Windham without a prior appointment and still potentially get vaccinated. Now, I have to note that because of the demand for vaccination, this walk-up option is first come, first serve. And those with prior existing appointments will be given priority. So I still recommend that you call and book an appointment. That number again is 888-445-4111. All of the slots for today are booked out. Thankfully, as I noted on social media this morning, we opened this up and folks have queued up and they're ready to get their vaccines. But tomorrow, Wednesday, as well as on Thursday, spots are available. Either call or, again, if your schedule is unpredictable, you can also show up without a prior appointment. And if vaccine supplies allow, you may be able to get vaccinated. It is first come, first serve. Now, this sort of vaccine without a prior appointment right now is only for the Windham site. We're not sure whether we'll be able to offer this, for example, starting on Saturday in Biddeford. Right now, this is only for the Windham site. The mobile unit is currently using Moderna vaccine. That's because even though we initially had intended to use Johnson & Johnson vaccine, the pause that was put into place a week ago meant that we had to pivot very quickly. The mobile unit is currently offering Moderna vaccine. That vaccine is authorized only for those 18 and over. Again, the Moderna vaccine is only for those 18 and over. We know that the Moderna vaccine also requires 2 shots. Given this rapid pivot that we had to make a week ago to shift to Moderna, we will soon be in touch with those who got their first shot at the mobile unit, either in Oxford or currently right now in Windham, to schedule their second dose. And finally, before I turn to some questions this afternoon, one reminder on testing. This is, as many folks are aware, school vacation week. Many families may be traveling, some are staying here, but you may be mixing with and interacting with folks who you may not have been interacting with or mixing with before. This is all the more reason to make sure that testing is something that's part of your plan. Testing is freely available across the state at a number of different types of venues, whether it's retail pharmacies or at a number of our swab and send sites, which remain online. If you happen to be traveling out of state outside of New England, testing or quarantine is required when you come back. I would recommend you make your plans now. Even if you're not traveling outside of New England, again, maybe you were hanging out with or interacting with groups that you haven't been interacting with before, maybe those groups are not yet vaccinated, testing is a way to keep you, your family, your kids safe, particularly before we look to going back to school next week. So I'd recommend that everybody build in plans to get tested before we have kids going back into school next week. Later this week or this weekend is a perfect time and opportunity to make an appointment for a slot to get tested. One of the surest and safest ways to reduce the spread of COVID-19 is for early and rapid testing. Because early rapid testing means we can identify cases, and folks who happen to be positive can isolate, reducing their likelihood of spreading it to others. Testing is freely available across the state. If you have any questions, you can take a look at the state of Maine's COVID website. There's plenty of information there on how, when, and where you can get tested. So with that, I'd like to turn things over to our colleagues in the media. The first question today goes to Chris Costa.
Hi there, Dr. Shaw. Sorry, let me just pull this up. Was looking at the reported vaccinations administered, I guess, so they were reported today, so they were performed on Monday. They seemed a little lower than what we normally do for a Monday. Can you explain why that might be the case?
Yeah, I noticed the same thing early this morning, Chris, and I've huddled with the team to try to get a sense of what might be going on. One hypothesis is that it may be related to the holiday. Folks just not some folks who had yesterday as a holiday, maybe not wanting to get vaccinated. But we've noticed the same thing, and as you've undoubtedly noticed as well, Chris, overall vaccination rates have come down. Now, Maine, I'm still very proud of how we're doing, but the absence of the J&J vaccine has meant that as a state, we're not administering the levels of vaccine we were 8, 9, 10 days ago. But I've noticed that same decline, Chris, and we've put out a word to sites to see what they saw on the ground that might help explain that.
Okay. We've also talked about a couple of times on these media briefings, the breakthrough cases, somebody who's been received a final dose of the COVID-19 vaccine, who then still ends up testing positive for the virus. Are you aware of what the current numbers are now? And then the second part of that question is, are there any classifications of a breakthrough death? Has anybody been fully vaccinated and then died from the virus, to your knowledge, in Maine?
Yep, sure, Chris. So as of this morning, we have recorded and verified 107 breakthrough cases across the state. When you set that against the 1 million doses that we've administered, another way to frame that is that 99.99998% of people who got vaccinated in Maine did not get COVID. It's about as close to 100% effective as you get in healthcare or public health. We do keep track of those cases, and we report them to the US CDC because they too are following those. And as we get reports, we verify that the person A, had COVID, and then B, actually had 14 days elapse between when they got diagnosed and when they completed their vaccination series. We have recorded one death in an individual who was receiving hospice care, who had passed away 14 days after their second dose of COVID-19 vaccine in connection with COVID. That's the only death that we are aware of, and that was that single individual who, again, as I mentioned, was receiving hospice care.
Understood. And last question for you here. I think a lot of people are starting to kind of look as we get towards the end of April, towards May 1 and some changing of restrictions. I think a lot of people are curious about outdoor gatherings and if the state has any particular benchmarks for cases, positivity rate, hospitalizations, total vaccination percentage of eligible people that the state would like to see when considering removing a mask mandate for outdoor activities and outdoor gatherings.
Yep, that's a good question, Chris. In recent days, there's been a lot more interest around outdoor mask mandates, what they are, what they accomplish, and whether they need to be in place. Some of the discussion around those, frankly, has come from or emanated in or concerned, I should say, states whose case counts are falling. Sadly, ours in Maine are high and remaining high. And so that's one reason I have some pause there. But I'm certainly aware of some of the recent writing and research that's been underway around mask mandates in outdoor settings. We don't have any announcements at this time, I am taking a close look at that to determine what it might mean for Maine. No announcements at this time. To your point about specific benchmarks, we're using the same approach that we've used thus far in the pandemic, the same approach that's gotten us here to date, which is that it's not about any one particular factor, but rather a blend of all the factors that you mentioned, not just positivity rates, but numbers of new cases, the number of folks who are in the hospital, the percentage of those who are in intensive care units, as well as things like the ages of folks who are being affected. It's a blend of all of those things, but specifically around outdoor masking, again, aware of some of the recent writing about this and the research that underlies it. Nothing to announce today. While we're still in this period of high cases that are staying high, that's where our focus is right now.
All right, thanks, Dr. Shaw.
Yep, thanks, Chris. Let me turn it over to Brian Sullivan next.
Thank you, Dr. Shaw. I wonder if what the plan is for people who get the dose through the mobile vaccination unit. Do they go back to the same place to get that second shot, or how does that going to work?
Brian, that's our anticipation right now. Now, of course, the mobile unit was originally designed, and the initial concept of operations was that the mobile unit would be using J&J vaccine, and thus there was no need for it to make repeat stops at locations. It was going to have one big circular route across the state, and that was going to be its route plan. With the pivot that we had to make in a matter of hours last week, switching to Moderna vaccine, we now have to review the route to make sure we can be back in those same locations on or about 28 days after those first folks did. We've got to iron all of that out before we reach out to people to give them an appointment for their second doses. But our expectation is that they will be able to get those second doses, generally in the same location, perhaps by the mobile unit. If not by the mobile unit, then we're working with we will work and reach out to, say, independent pharmacies and EMS agencies to see in those rare instances where the mobile unit may not be able to provide those second doses, whether some of those other groups can.
So I guess, and I don't have the schedule directly in front of me. So say, for instance, Wyndham this week, 4 weeks later, you're supposed to be in Old Town, can't be in two places at once. Would you shift the Old Town clinic a little bit, or would you shift the second dose a little bit more?
I can't say, Brian. We really have to plan it out. A lot depends not just on the unit itself, but on the staff. Even though many of the staff are from FEMA, they're not committed to the entire 60 days. Some are rolling on and some are rolling off. So we've got to make sure that any changes we make are not midway through a stop. So the logistics here are more than just sort of rerouting it to one place. If you've been to the site, you also will note it's more than just an RV with an awning and some chairs out front. It's a pretty, the traffic flow has to be mapped out. And so going back to a site requires making sure the parking lots are available, all of those things. So we're going to make sure we get those things in place. But one other important note, Brian, not long ago, around about a month ago, maybe 6 weeks ago now, we put out notice to vaccination sites that they should feel free, in fact, they are required to administer second doses to folks who did not get their first dose at that location. So if someone got their first dose in Lewiston, but their schedule works out such that they want to get their second dose in Bangor, that's totally allowed, and we've told sites that that's where they need to go. So even if somebody can't come back to the same location, say 26 days from now to be back in Wyndham, they can get their second dose at a place that's closer to them, that's convenient for them.
Okay, and I just have one question about the card that people receive after that second dose. I have a coworker who was told, make sure you hang on to this because if you want to travel, you're going to need it. And I guess that maybe speaks to vaccine passports, and that maybe is more of a private industry decision that would be made. But how do you see the future of perhaps vaccine passports and what it would allow for people to perhaps partake in?
So Brian, in general, you're right. I recommend that everybody hold on to their vaccine card, not because it's necessarily part of the travel scheme, which I'll talk about in a minute, or any travel arrangements, but because it's a medical record. It's one of your medical records. And for example, your primary care doctor may not have received notice that you got vaccinated. And so that card will be helpful for your primary care doctor to know when you got vaccinated, with what doses, from what lot numbers. It's a medical record, and you should protect it and hang on to it in the same way that you would protect and hang on to any other medical record you might have. In terms of things like vaccine certifications or verifications, any system of that nature would not necessarily rely upon that white card that everyone receives. It would actually be based on an IT system that queries different states' IT vaccination databases and uses that as the basis of verifying whether you in fact have received your vaccine or not. So the white card may or may not be the mechanism that's used for that. It would probably be that verification would happen through a separate IT mechanism, not necessarily through the analog card. But again, not a reason to throw the card in the back of the junk drawer at home. I would make sure you keep it, take a picture of it, scan it, laminate it, whatever you've got to do to keep it safe.
Thank you.
Mm-hmm. Over to Bonnie from the Sun Journal next.
Thank you, Doctor. Androscoggin County, the cases continue to be quite high per capita, pretty much higher than anyone else. I know we've asked you this before, but what's going on?
Yeah, it's a good question, Bonnie. I mean, what we're seeing in Androscoggin County are two things. One is some focal outbreaks. For example, the outbreak at Bates, which thankfully is not seeing the intensity that it was a week, 2 weeks ago, but there are still some cases, and additional cases may be detected as well. So we're seeing that focal outbreak, but we're also seeing high degrees of community transmission across the county. This is all the more reason why folks in Androscoggin County, the best way we can get those numbers down and keep people safe is to get vaccinated. There are appointments available at the Auburn Mall location that's being run in conjunction with Auburn EMS, Central Maine Medical Center. Appointments are available there. This is one of the best things that folks can do.
Okay, secondly, is there a breakdown for Androscoggin County about race and gender on the vaccination or the case rate? I was communicating with a local Somali leader, Ron Osman, who said they were working with their community to get people vaccinated, but when the J&J pause happened, it really scared a lot of people. So is there any breakdown that shows that the immigrant population is less likely to get vaccinated or more at risk?
I can check and see if we've got those county numbers. It may already be available on the dashboard, but either way, Bonnie, we can check and see. But certainly, the pause on J&J has, for many folks, thrown a bit of a monkey wrench into the plans that they had to be vaccinated. Many folks were basing their vaccination decision on the J&J vaccine, for example, either because it was the one they preferred or it was the one that worked better for their schedule. Later this week, the US CDC's advisory committee will be meeting to review what I hope will be more data around what they're concerned about. But in the meantime, though, let me take a moment to reassure folks. While you may have been building up to wanting the J&J vaccine, the alternatives, whether it's with Moderna or with Pfizer, are just as safe, just as trustworthy, and just as effective as the J&J vaccine. Indeed, when I've received calls, emails from friends and family members who themselves were hoping to get the J&J vaccine and were asked to pause because of the nationwide pause, what I've told them without missing a beat, without fail, is that rather than waiting for any pause to be resolved, they should just go ahead and make plans to get the Pfizer or Moderna vaccines. That's what I would recommend that folks do rather than waiting for any of the pause to be resolved.
And I haven't checked with the Auburn Mall this week, but you said, and last I knew that the appointments were filling up and it was still difficult to get one. But so are you saying that that's changed? There's more appointments available?
The last time I spoke with officials who were running the Auburn Mall, they were able to have slots available. Now, it may not mean that the time that you necessarily want is available, but they did have additional slots available. Does that mean it's going to be today at 4 p.m.? No, that may, it may take a little bit more time, but it was possible for folks to get slotted. They're receiving about 3 trays of Pfizer per week. And that is, from what I understand, able to meet the demand that they're seeing.
Okay, and St. Mary's is doing a clinic at the Longley School in Lewiston this Saturday, but they only have 800 shots. Will they be getting any more than that? Because that seems to be an area where they could really use
we don't know what we're going to be getting from the federal government right now. And so without knowing what our state allocation is, I can't comment on what anyone else may be getting this week.
Thank you, Doctor.
Let me turn it over to Amy Brown next.
Thanks, Dr. Shah. Can you give an update on how many cases of each of the variants have now been detected in the state, and also maybe speak to what can be extrapolated from that to what it means, how much of it might actually be in the population?
Sure. So as of right now, there have been 30 cases of the B117 variant that have been detected, 3 cases of the 1351, and 1 case of the P1 variant. Making extrapolations based on those is very difficult. The CDC has been working on trying to understand what that means. It's a function of how much testing is underway. Maine is one of the states that is conducting the highest volume of testing of positive samples. We're well over 5%, 5.6% at last count, whereas most states are well below that. The CDC recommends that states do 5%. And again, we're a good measure above that. But even then, it's difficult to extrapolate what that means for the raw number of cases that might be out there in the population. I think the bottom line, though, Amy, and what I think is important for everyone to remember, is that variants are absolutely circulating in Maine. All 3 of the principal variants of concern, the 117, the 351, and the P1, have all been detected in Maine, and we should assume that they are across the state.
Do you think it's odd that there's still just been 1 of the P1 detected after it's been a few weeks at least since that initial one was detected, right? Because they're supposed to be highly contagious.
Well, we managed to isolate that individual very quickly, so I can't comment on whether it's odd or not. We jumped on it very quickly and did what we could.
Okay. You're speaking of people who had breakthrough infections, and the person who died in hospice care, was it determined that their death was primarily due to COVID or due to the illness for which they were receiving hospice services?
Amy, I won't comment on individual cases.
Okay. With what you've said so far, what I'm trying to determine is whether you were telling us that we've had a breakthrough case that has resulted in a person dying from COVID.
That's correct.
We have had, okay. And are we at or approaching a point where supply will exceed demand here in the state?
I don't know. We don't know what the future supply of vaccine will look like. That's really more a question for the CDC and the federal government.
We're not at that point now, though.
Where supply is exceeding demand?
Yeah.
No, I think we're still seeing very strong demand across the state.
Okay, thanks.
Let me turn it over to Megan next.
Dr. Shah, just following up quickly on those breakthrough cases, were you, in order to be considered a breakthrough case, do you have to be fully vaccinated or can it be after 1 shot?
No, you have to be fully vaccinated. And that's why we have a team of epidemiologists who, among their various duties, is to take reported cases of individuals who have gotten confirmed COVID, who indicate that they've been vaccinated, and then compare that against our registry of who's been vaccinated to ensure that if they got COVID, it was 14 days after their 2nd dose or their 1 dose of J&J.
Okay. And Do you think there's a correlation between the loosening of restrictions here in the state and rising cases? We mentioned last time we spoke that variants are likely a part of that as well, but is there correlation or causation?
I don't know that it's causation. If you take a look at the increase that's happened across the country, it has been in or even in New England. It's been in states that opened up their restrictions at different times, but all generally experienced an increase in cases at pretty much the same time. So it's not clear to me that there is a direct causal link between the small opening of restrictions, in our case, increasing capacity limits somewhat, so on and so forth, and the increase in cases. My hypothesis continues to be that it is driven predominantly by variants.
Okay, thank you.
Mm-hmm. Over to Caitlin Andrews next.
Hey, good afternoon, Dr. Shah. We have noticed just a few small rural hospitals have put out statements saying they're halting vaccine clinics. Some have said they've had a hard time filling appointments. Others have said it's because they've stopped getting any vaccines and so they just cannot. And so I was curious to know if you've observed, what you've kind of observed around that. Are you seeing some areas experiencing less demand or having a harder time filling appointments in particular? And is the state changing how it sends vaccines accordingly?
Yeah, we've noticed a little bit of that, Caitlin, just a little bit. I mean, I still stand by what I said in connection with Amy Brown's question, which is statewide, we're seeing strong demand. But you're right, in a few instances, very few, we've had hospitals say that for the first 20 weeks of vaccination, we're requesting 800 or 1,000 doses every week, and then are now requesting fewer than that. 600 or 700 rather than 800 or 1,000. But and then in a few instances, we've heard from hospitals that have said that they have had difficult times filling their appointments, but they've been able to by working the phones, calling patients, things of that nature. So it's been sporadic, it's been intermittent. We are of course taking that into account. Generally speaking, when we allocate doses, our starting point, and we've talked about this before, as you know, Caitlin, our starting point is what did that facility request? And if their request is lower than it has been, we take that as a sign that they know the demand in their community better.
Okay. Can you kind of explain a little bit more about where you're seeing those? Is there any kind of like geographic connection between those few instances? And if the state is like choosing to not give vaccines to those, any of those places, like how does it make the decision to say we don't see enough demand here?
Oh yeah, let me start with that latter one. I'm glad you raised that directly. I am not the arbiter of what demand is. We rely upon the facility on the ground, whether it's an EMS agency, a hospital. We rely upon their analysis and their knowledge of their local community to assess what the demand is. And they do that by the request that they put into us for doses. So we have not, I don't think, Caitlin, and if I'm wrong about this, I'll correct it, but I don't think we've had a hospital or an institution say, we don't have any demand in our neighborhood, we don't need any doses. I'm 99.99% sure of that. What we have had are a few instances in, principally in Somerset County, and then a little bit in Piscataquis, where some hospitals have said, hey, I know that historically we've asked for 600 or 700 doses, but this week we really only think we've got the interest for 500 doses, that sort of thing.
Mm-hmm.
Does that answer your question, Caitlin?
Yeah, and so I guess I would I know again, we have probably already touched upon this twice in this press briefing alone, but what do you kind of make of those instances where you're seeing less and less? What's going on there?
I mean, I just want to go back to something just to be crystal clear for everybody. Our understanding of demand comes from those folks on the ground who are ultimately scheduling and administering the doses. That is how we understand and assess demand. We use their request, who they have scheduled, what do they have on hand, what do they anticipate, what does their wait list look like? Those are the factors when I think about demand. That's really what I'm referring to concretely. It's not some abstraction or some vague notion that I have. That's the concrete things that we look for. And again, I rely upon their assessments of demand, not anything that I come to on my own. Caitlin, but more generally, I'm going to engage in something that's unwise, but it's a gross oversimplification. That this is how I think about the vaccine world. There are generally, I think, 4 or so groups of folks. The first group of folks are those who wish to be vaccinated no matter what. They don't need an educational campaign. They're ready. They were first in line on December 14th, and they've been ready to go. Another group of folks are those who are interested in getting a vaccine when it's convenient for them. Another group are those who may or may not be interested in getting a vaccine because they've got questions. And then there's another group that, irrespective of the amount of messaging and the number of times their doctor's office calls them, they're not going to get a vaccine. We've clearly seen strong demand from that first group, no question about it. And I think it stands to reason, Caitlin, that nationwide, worldwide, as well as in Maine, we're starting to move into some of those other groups. That second group that is focused on convenience. We'll get the vaccine, but when it's easy for them to do. Hence the moves that you and I talked about last week around unscheduled time periods for folks to get vaccinated. There's a direct connection between those two. That other group, that third group, is they've got questions. Hence why from time to time on these briefings, I answer questions that folks send in. And then that latter group, we're gonna keep talking to them.
Okay, that is helpful. Thank you. Different questions, slightly pivot. A rule change was announced through DHHS that said that the department would be able to impose mass vaccinations and exclusions from the workplace and documented immunity for healthcare workers. And I was just wondering if you could give me some clarification on whether this is geared specifically towards state healthcare workers or healthcare workers in the state in general. And so one of the inclusions in the rule change was immunization against influenza. And is that meant to be inclusive of the COVID-19 vaccine?
Right now, so to your questions, to the former question, it's focused on all healthcare workers, not just state. And then as to the COVID, haven't made any determinations on the inclusion of COVID as part of that. Right now, it's focused on influenza.
Okay, thank you.
Yep, thanks, Caitlin. Over to Kevin Miller next.
Great, thanks, Dr. Shaw. So first question, I know we're obviously doing pretty well as far as relative to other states getting shots into arms, but we are seeing these higher rates of new cases. And we all look at different metrics. I'm sure you track a whole bunch of them. There are some of those rankings that show per capita per 100 cases per 100,000 residents show us pretty high. Top 10. You talked a little bit about this last week, I think, but when you see those high case rates per 100,000 residents, kind of what's that telling you? Why is this happening here in Maine versus more so than other states? And is this that we're also testing more, so we're catching these more?
Well, let me start on the latter, Kevin. I don't think our volume of testing, our testing level is very robust. We are, when you include PCR and antigen, both of which test for current transmissible infections, or what some folks sometimes call active infections. We are conducting about 870 tests for every 100,000 people, which is a very robust volume. It puts us up there on, even on the international league tables in very good stead. And I don't want to say that we're testing more, but what I will say, Kevin, is that that robust volume of testing gives us confidence in the precision and accuracy of things like the positivity rate. It means that the positivity rate tells us what's happening. More generally, I too have, and our team has talked about the exact question you raised, Kevin, which is how do we reconcile high vaccination rates with high transmission rates? One would think that following the example of some other countries like Israel, we would start to see a decrement. What's going on there? I think what is somewhat happening, Kevin, is there are again, I'm going to do something that's really inadvisable, but I'm going to grossly oversimplify the situation. But I think what's happening from an epidemiological perspective, it's got a technical term. It's called a syndemic, which is two parallel occurring epidemics that are unfolding in the same real time together that may or may not have interconnections with one another. That is to say, two things occurring on the same tracks. In Maine, what I think that looks like is a population of largely older individuals who were vaccinated first. And as a result of which, we've seen a significant decrease in the cases amongst those groups. I may even try to post a graph a little bit later showing that decrement in cases among older Maine people directly as a function of vaccination. But those groups may not necessarily interact with younger Mainers as much. That is to say, they have been largely cordoned off. And so the fact that they are vaccinated doesn't really reduce the likelihood among younger Mainers that there are interactions that might lead to COVID, right? So in order for there to be population level immunity, a lot of folks that intermix with one another need to start being vaccinated. But if older Mainers are largely cordoned off, then the fact that they've been vaccinated doesn't really help slow transmission among younger Mainers who are just now getting their vaccination numbers up. And when you couple that sort of syndemic phenomenon with variants which are more contagious, that is my hypothesis right now as to why our case numbers are high and maybe even staying high and maybe even going higher.
Okay, great. Just going back to the breakthrough cases, have you guys taken a look at how many of those out of the 103 or whatever it was, how many of those had symptoms? How many of those had severe cases?
Oh, yes. Okay. I thought you were going to ask another question, which I will go ahead and answer anyways. But as to symptoms, I'll get you very few. It was fewer than 20% who had symptoms. And I'll also get you the numbers of those who have been hospitalized, or I'll try to provide them to everybody. Very, very few hospitalizations, far fewer than would be expected in an unvaccinated cohort of 107 people. And proof positive there, of course, that the vaccine works very, very well, even though folks on occasion may have gotten COVID. Again, 99.99998% didn't. And then even among those who did, very, very, very mild cases, very few hospitalizations. And then where I thought you were going, Kevin, is are variants driving this? Is there a link between variants and breakthrough cases? And as of right now, we have not seen a clear relationship. That is to say, variants are not overrepresented among the breakthrough cases.
Okay, great. And then one last question just about vaccine distributions to the retail pharmacy program. We did see a decrease that went to the pharmacies this week over last week. Do you know kind of what's going on there? It's not just attributable to the J&J because we didn't have any J&J vaccines last week either.
Yeah.
Is that a function of less demand that you're hearing on that level?
No, I don't think it is, Kevin. But one important process note: we do not control the allocation to the retail pharmacy program, the allocation that goes to, nor do we control the allocation that goes to federally qualified health centers. Those are made independent of the state and are made directly by the federal government to those pharmacy chains. So they do not seem to be a function of either things like demand, and certainly not a function of anything that Maine CDC does. But more generally, Kevin, you raise a really good point, and it's concerning because when you factor in all vaccinations that are coming into the state this week, Maine is actually getting fewer vaccines than we got last week, right? So last week, as a state, we received 53,710 first doses. This week, as a state, we're getting 50,780 first doses. 2,930 fewer first doses that are coming into the state this week as compared to last week. Some of that is a function of the pause on J&J, but I'm not sure if all of it is.
Great, thank you.
Let me turn it over. Let me rephrase that last piece, Kevin. Some of it may be a function of the pause on J&J, but there may also be other factors at play as well. And let me go next to Charlie at Maine Public.
Hey, thanks, Dr. Shah. First, just a follow-up question from the breakthrough cases. Have you been sending all of those or some portion of those for the gene mapping to look for variants? And yeah, is that happening with all of them or some of them? Yeah.
Well, Charlie, the answer is that our approach is to try to sequence every single breakthrough case. Sometimes in a couple of instances, it hasn't been possible because, for example, the genetic material from the person's original test, they may have gotten their test from, I'm just giving you a hypothetical, from a saliva-based test. In tests that were done on saliva, that genetic material cannot be salvaged in order for there to be genomic sequencing. We try to reach out to folks to get a new sample. Usually we are able to. Our policy is to try to sequence every single breakthrough case, but as we get more cases, it may be harder to do that because of some of these technical difficulties. So we may not be able to do it in every single instance, but that is our policy.
Okay. Can you say, I think the governor may have mentioned this last week, just in terms of the larger question of vaccine hesitancy and with the concern that the Johnson & Johnson pause could be contributing to it. What can you speak in any detail about the state's current or future efforts to conduct education that might combat some of that hesitancy into, you've mentioned the 4 categories of people, maybe to get some of the 3rd and 4th categories into the, first or second categories?
Yeah, absolutely, Charlie. We've been focused on doing this in various and different ways since December 14th. Some of it is what we do during these discussions, which is talk about the vaccine, talk about who's getting vaccinated, answer questions. Some of it is social media driven. We're working with Facebook, Instagram, and others to do 2 types of different campaigns or ads, those targeting those 2nd and 3rd groups. One type is convenience driven. Hey, you want to get vaccinated? Click here, that kind of thing. Another is more driven toward question and answer for that 3rd group. So both of those, Facebook, Instagram, et cetera, should be getting in the water pretty soon. As of last week, we had given the content to Facebook for their review, and we were just waiting on a thumbs up or thumbs down from them to make sure it was good to go. And then another piece of this, Charlie, that I think is important. Recent survey data suggests, national survey data suggests that for those who have questions, and maybe even for those who are at the outset convinced they don't want the vaccine, to the extent that there are messengers that work for those groups, what some survey research has found is that overwhelmingly, the one group of folks that those folks will listen to are their doctor or doctors. And so we've been working with the Osteopathic Association and the Medical Association to cut quick ads of Maine doctors talking to their patients about why it's important to get vaccinated, why when they were offered the vaccine, they got vaccinated. And we're looking for different ways we can use those. Some of it may be in mass media, but I think some of it may also be individual doctors' offices taking a minute to send a link or an email to their patients saying, hey, here's Dr. Jones, and she wants to talk to you about why you should get vaccinated. That's something that I think is really critically important for those third and hopefully even those fourth groups.
Great. And sorry, just one more about the mobile clinic in Wyndham, the walk-in appointments. Can you just articulate what sort of population or what benefit do you think that could bring by opening those up?
Great. And Charlie, we're starting here. Two just important notes at the top. Right now, it's Wyndham only, not Biddeford, not subsequent sites, not Freiburg yet. Right now, this is only Wyndham. Secondly, to your question about, and sorry, second thing is we're not done with no appointment or non-appointment vaccinations. We're working with other sites across the state as well to roll out some more times and hours. But Charlie, where I think it is valuable is in that second group that I mentioned a moment ago. Folks who are interested in vaccines, but for whom convenience is a premium. These may be folks that just don't have the time to call a number or go online and schedule, or for whom the normal hours just don't work. They don't have the predictability in their day to know for sure that at 10:25 a.m. on Thursday, they can be at a particular location, but rather the flexibility to say any time between 8:30 and 4:30 would work for them. That may be because their work schedule doesn't allow for that precision. It may mean because, again, they don't have the control over their day to know exactly when they can take 20 minutes. I think that's the group that is for whom convenience is the premium. These unscheduled hours, that's really where I'm hoping to offer a service. And indeed, Charlie, since I put that on Twitter this morning, all the unscheduled appointments have been snapped up in Wyndham.
Okay, thank you. Appreciate it.
Yep. And the last question for the afternoon goes to Patrick Whittle.
Thank you very much.
Oh, I'm sorry, Patrick. Sorry.
Oh.
Gosh, I'm just not being complete in my thoughts. Charlie, to go back, all the unscheduled appointments in Wyndham today have been snapped up, but those for Wednesday and Thursday remain, but all the unscheduled appointments today in Wyndham have been snapped up. There's still the possibility that there may be a dose or two left over at the end of the day. So that's still something if you really want to roll the dice, but it's just as easy to call ahead and book something tomorrow or show up tomorrow at some point or Thursday. Sorry about that. Patrick, back over to you.
No problem. And thank you very much. I had a couple of things. We've noticed through the data provided to us by Johns Hopkins University that in the state of Maine, not just the daily case rate, but the daily death rate has gone up over the last couple of weeks by somewhere in the neighborhood of about 75%. Could you speak to that?
Sure, Patrick. One note there is it depends on sort of where you start the story. That is to say, the death rate has come down significantly since what we were experiencing December, January, even into very early February. But what has gone up, though, since then has been not just the case rate, but also the death rate. And I will also add on to that, Patrick, the hospitalization rate. Just a few weeks ago, we were averaging quite steadily 70 to 80 people who were hospitalized at any one time. Now that number is over 100 to 110. All three of those have gone up. I think it goes back somewhat similarly to what I noted for Kevin, which is there are two relatively distinct groups in Maine. And when you factor in the younger population, the contagiousness of the variant, and perhaps even the greater seriousness of the variant, whether it means landing people in the hospital more, or alternatively, even causing more fatalities, I think that's what we're seeing unfold.
So it's a product of variants then, we think.
That is my hypothesis right now. It squares with the increases in variants that we've seen. It squares with the international data that have been reported about their contagiousness and their seriousness. That, to me, that hypothesis right now has the most explanatory power. There are other hypotheses, as Megan noted, any potential connection with reopening. We've analyzed that. I don't see a clear link, but it's possible. There's also possibilities of, maybe there are still these smaller congregations happening. Certainly, we've seen a high number of cases lately on college campuses. That definitely contributed to the increase in cases. It was across a number of college campuses. So that's part of the mix as well. But again, I think the data suggests that variants are what ties a lot of these together.
Okay. What follows is a three-part question, and it's possible that the answers are, I don't know. But I would love to know what the percentage needed for herd immunity is in the state. Do we think we'll get there? And is it different from what the national percentage is expected to be?
Okay, number one, the estimates suggest that the percentage of any given population that is needed to achieve population immunity, the percentage of vaccination needed, depending on which epidemiologist you follow, it's anywhere from 75, maybe 85%. There's a number of reasons why every epidemiologist has their own model and their own estimate, but that's the ballpark we're talking about. Do I think we'll get there? Let me answer that one third. Second question, is that different from anywhere else in the state? It's not. These models apply to populations irrespective of geography. And indeed, Maine's got, so now I'll answer the middle question, which is, are we going to get there? That's my goal. There's no question about that. And Maine started our vaccination journey from a lower relative number of cases, which puts us in a better position to halt the spread, even though it doesn't seem like it right now, as well as achieve that higher level of immunity. Our goal is to get every single person in Maine who wants to be vaccinated. If there's any state in the country that can get to that 75 to 85%, it's going to be Maine. It's absolutely going to be Maine. I think we've got as good a shot, if not the best shot, of any other state to get there.
See. One final thing, a couple of the private colleges in the state have announced that they're going to be requiring coronavirus vaccines to return to campus. And at least one of them has also said that that's contingent on moving from being under the emergency use authorization to having full FDA approval. Unless I'm mistaken, I don't think we know when full FDA approval could possibly be. I think it's possible it might not be by the fall. So are those requirements going to be able to be in place if it's not approved yet?
Patrick, I'm not 100% sure. As you noted, some groups have based their requirement upon full approval versus the emergency use authorization. Others have not. I don't have any specific or particular insight into when the FDA would grant that full approval. It's what's called the BLA, the Biologics Licensing Approval. I'm not sure where the vaccines are in that various process. But what I will say is this, though. I just want to emphasize for folks that although there may be reasons why different groups may look upon these things differently for regulatory purposes, for the average, those of us who are just looking to get their shot, there is no difference between the two. The vaccines, having received emergency use authorization, went through the same rigorous scientific study and development process that would have otherwise been gone through had it gone through the normal authorization or approval route. As I've mentioned before, there's a notion out there that by going the emergency route, corners were cut. When that wasn't the case, What was cut was red tape, not corners when it comes to safety. So I don't have any concerns over the safety of these vaccines, or to put it differently, I don't think the vaccines in my mind will be any more safe or more effective if they were to receive full approval versus what we have right now.
Okay, terrific. Thank you very much.
Yep. And then, yeah, so I think that's where we are on that front. And then going back just for a moment to what it's going to take. The final note there, Patrick, going back to the population immunity, some parts of the world have already started to achieve that high degree of saturation of vaccination coverage. Some countries as well as some regions have. And unsurprisingly, having achieved those high levels of vaccinations, they have seen case rates fall. They've seen hospitalizations plummet. That's certainly our goal. And again, if there's any state that can do it, it's going to be us. It's absolutely going to be us. Or it's going to be, well, we'll get it done. So with that, thank you all for your time this afternoon. Very much appreciate the questions. Appreciate everyone taking a minute to tune in. I hope everyone has a great day. We look forward to chatting with everyone again later this week. In the meantime, as always, please be kind and take care of one another. We'll catch up again on Thursday.